Hi, folks. Welcome to the OFM podcast again. And I'm your host and collaborator in this enterprise, Peter Defty. And with me today is Dr. Cathy, who is part of our team. And so we're continuing a series of conversations and interviews we've done with Cathy today because approximately 4 weeks ago, you completed Ironman Maryland. Right?
Yes.
Right. And no, she wasn't going for an age group or a win or a PR. I think what's important and relatable about this is Cathy's got a pretty busy life as a trauma specialist, both as a trauma surgeon and an ICU physician, and also with a family. You've got a teenage daughter, a partner. So you've got it all going on, right? Right. So, and this is the lives most of us live, and so Cathy, with her schedule, and you're also the director at your hospital, aren't you?
No, at the last hospital. This hospital, I'm just one of the intensivists.
Okay, but the point is, being an intensivist or an ICU doc, and also a trauma surgeon who can and will jump in at the drop of a hat if she had to. You know, like most of us out there, we're all leading very full lives. And, you know, I think what's relevant and why we're starting this conversation right now, or having this conversation right now, is because, you know, Cathy is able to train and complete an Ironman in the midst of everything else going on in life, including Ian, right?
Yes, including the hurricane, yes.
Including the hurricane. Okay, cool.
Well, you know, I think it's really important, and my life is no different than anyone else's, just as you said. And when I started on this journey back in about 2014, 2015, that was the first time I had the realization that I can't ever expect anything more of my patients than I was willing to do. I had to really walk the talk. So, you know, your doctor should be among the healthiest people that you know. And that was certainly not my situation at the time. And unfortunately, it's not something that a lot of people run into. So you can't say, well, I know how to be healthy, but I'm just too busy. So I think it's important that I don't train and race because I want medals or t-shirts. I train and race because it's part of a good life, and it enhances the physiology. I think gives us an opportunity to regain what we've lost because of our modern lives. You know, in the remote past, our ancestors had to move all day and be fit to survive. But with all our modern conveniences today, that is no longer a necessity. And between the lack of movement and I would say the change in our diet, the modern life is no longer one of luxury. It's really, when you look at it from my perspective, it's killing us. So the innovations that we've made have now allowed us to circumvent the very things that kept us alive and healthy, and namely finding food. And they've provided us with foods that are not only readily available, but nutritionally not nearly as good as what we used to eat. So from my perspective, I don't see myself as a person or a doctor that races Ironman. That's just a fun outlet for what I do as a part of what I think should be somebody's normal daily routine. You know, and it's just like meditation. You know, there's a saying, everybody should meditate for 20 minutes a day. And we could talk about the physiologic benefit of that. But if you don't have time, then you should meditate for an hour a day. And I think the same is true for movement. If you can't make time for, movement, and I use that word more now because exercise has kind of a bad connotation to it. Movement is as critical as oxygen and food and water in my mind. So if you can't make time for movement in your day, then there's going to be a heavy price to pay, and you're going to see me in the ICU, unfortunately, sooner rather than later, because patients are getting younger with manifestation and serious consequences from chronic disease states, namely, as we'll talk about in this podcast. But it's just devastating to me as a doctor. Some days I don't want to go to work, not because I don't enjoy my patients, but because I see so much needless suffering, and people in the ICU and their families are so surprised when it's not a surprise to me at all. And I'm just surprised often that it hasn't happened sooner. People are dodging bullets every single day and they don't realize it. And I feel now the ethical and the moral responsibility as a doctor to tell people and to promise them that everything that I speak is road tested by me and is well documented in the scientific literature, although it's been marginalized a lot, and is people are healthy. There's really nothing wrong with your body. And people have become their diagnoses and their family history. And it's almost like people now have this collective consciousness that there's something wrong, intrinsically wrong with the human body. And if you think about it, most interventions in medicine for chronic disease don't stop the progression of the disease. They're aimed at treating the symptoms of the disease. So, as a trauma surgeon, there are a handful of things that I can do on an immediate basis as a surgeon, as a trauma surgeon, as well as interventional cardiologists and neurosurgeons to reverse an acute situation. If you have a collapsed lung, or you have a bullet wound, or you have a heart attack that's in progress, or stroke, there are interventions that can be done to stop you from dying in that moment. But there are very few interventions offered outside of procedures and pharmaceuticals to actually restore the body's balance and properly functioning physiology. So that's one of the frustrations for me, is I see people getting acute interventions that save their lives, but where we're falling short is now telling them the lifestyle changes they need to make that will prevent them from the disease that brought them in from progressing. And I'm really at quite a crossroads in my career because enough is enough, And I think it's very then brave of you, Peter, and of the team to go forward and speak, the lesser narrative that is more true and is true. And that's where I am so grateful to have an opportunity in this podcast to talk to people.
Yeah. So, I think to frame this for the audience, especially if this is your first time seeing Cathy live and talking about this, is you've got this spectrum, and Cathy's on both ends of the spectrum in her profession in the ICU and trauma, seeing this end of the human health, and then at the other end, being able to train and complete an Ironman as a fat adapted athlete by optimizing your fat metabolism. So athletes don't escape this. So yes, exercise movement is absolutely critical, but it's one component of your overall health picture. And the other thing I want to also frame right now to accentuate what Cathy was saying about her work is we're not here to bag on modern medicine and all that, because literally from my perspective, it's a miracle. When I look at what people like you and Jonathan and my friend Jim as their anesthesiologist, what you guys do to keep people alive, is like, it's amazing. But the point is we want to try to get people as far away from being in an acute situation as possible, so that if something unusual happens, they've got that resilience to where the doctors can really help them out. And from your perspective, both in the athletic world and, well, in your perspective in the hospital, you're seeing that what you're suggesting is a lot of the things you're seeing are completely preventable and or exacerbating acute situations.
100%. On the rare occasion that we get a healthy person, their resilience and their ability to heal is so much faster. And that's the way it's supposed to be. So,
yeah. And we need to qualify also, one of the things, the other thing we need to frame, and this has been a big topic of my thinking about things right now, and we were talking about this Tuesday, is because of modern convenience, whether it's food, comforts, whatever, we kind of dumbed down health because, nature, evolution, those pressures that shaped us as humans, they forced us to be on point and develop it. What's considered healthy today. I mean, I talk to people who tell me that they're healthy because their type 2 diabetes is well controlled.
yes, that is one of the very difficult conversations I have to have with patient families when I hear this statement all the time. They were fine last week, and all of a sudden, and the patient is, 100 pounds overweight, has pre-existing coronary artery disease and lung disease or kidney disease. And I have to say bluntly, your family member hasn't been fine for decades. And so that's kind of this, what we now accept as normal is not normal at all, but it's usual. And people are confusing what's usual to be what's normal. What's normal is...
You're normal, Cathy. That's
yes,
what's normal.
Completing an Ironman, that is physiologically normal. And people say, well, I can't do that. And, but that's why as a doctor, I feel the obligation to demonstrate the way. And you don't have to necessarily, I think people have in their minds what it takes to train for an Ironman. And that's also very important, because if I can fit it into my schedule, most people can fit it into their schedules. And,
well, and to a point, you're absolutely right, but people need to know, just for relatable, because most people aren't willing to do that. You don't have to train for an Ironman. I mean, just to get 80% of the way there, I tell people, getting to the level where you could do, if you're a runner, you could do a half marathon or walk a half marathon, or just anybody can go and do 2 to 3 hours of physical activity,
yes,
cleaning the yard or walking, going for a hike, 2 to 3, 4 hours of physical activity, aerobic physical activity, where you're not wrecked, you're not bonking. That's a good baseline health thing. Now, completing an ultra or an Ironman or a Spartan race, that's icing on the cake, right? And yes, you're going to leverage your health a lot more, but like you say, you're setting an example as a physician by completing an Ironman. But we want the audience to know it's okay. You don't have to do an Ironman or run 100 miles or climb Mount Whitney like I do. You just got to get moving and get the diet sorted out in the lifestyle. So
yes.
yeah,
being able to move, being able to move for a couple of hours, half marathon, or being able to carry 2 toddlers under under each arm to get out of your house if it were on fire, being able to be a asset to your family in an emergency situation like that and not a liability. I always say to people, if you have to be carried out of your house or carried out of a burning building, you're a liability. And that is not normal physiology. Tarzan is a normal human being, you know, and having that functional fitness. So can you, like most people pay somebody to do their yard work so they can sit down and relax, when what they actually need is to do something for a couple of hours, like their yard work, you know, or something else where you move all day, not realizing that over time, the investment in that movement actually gets rid of that chronic fatigue. And that, in concert with being fat adapted, it's so critically important, because I know what I'm feeling after Ironman because of the way I eat and train. The actual, you see a lot of athletes get wrecked after a race like this. When this is just, it gives, being fat adapted, doing an effort like that gives you a bounce to a new level of
Right.
fit.
It becomes, as I say, after the event's over, it's another training session.
Oh, it feels so good. And people really, I think, have forgotten what it's like to feel good. And it is normal that even as a 20-year-old or a 30-year-old, to be able to keep up with your toddler. Lots of parents are so tired. The kids get up, you know, 5 o'clock in the morning and they're ready to go. And they may have a solid nap in the middle of the day, and they get up and they're ready to go till they collapse at bedtime. That's normal, right? That's that kind of energy. And, you know, obese children are not normal. There's, you know, I hate that I have to give this disclaimer, but as a physician, there is no judgment here about what you're doing, how you look, what you wear. There's no judgment. But I will not say it's okay and it's normal to be obese, you know, or to be unable to, like you said, move for an extended period of time throughout the day, you know. And so it's really important that people understand that, you know, you only have to look as far as Mother Nature. You know, if you're a fat lion, you know, and you can't catch an antelope, you're going to die, and you're not going to procreate, and you're not going to have offspring that also adopt those behaviors, right? So what I'm talking about is, it's definitely a change from the way most people live their lives, but it's a reversion back to a place where we can enjoy our physiology. And the beauty of it is now we don't have to do it to survive, but if we do it, you can actually thrive. And I think we see that in lots of our athletes, certainly like
Yep.
Jeff Browning's, like last week at Moab 240. I mean, running 240 miles and not, you know, and just kind of walking away after the finish line, and then feeling better and better as the days went on. That's just, I don't think people have really tapped into what human physiology can do.
Yeah, and running 240 miles is that's what we're doing, is we're doing this ragged edge stuff at OFM so we can take what we learn and bring it back. But you're right. It's like Jeff's a perfect example because he's doing everything on point, right? And it allows him to.
Mothers would do that, because we know now that the influence of diet starts in utero, and that child develops in utero. And if the mother has been able to live and successfully procreate in her environment, the child will be loaded with the same behaviors and tendencies to survive in that same environment. And this is not to in any way, you know, dumb down the process of procreation and why we're here, but this is what our environment does, right? So we are seeing now more and more obese children, little children, because of the way their mothers eat while they're in utero, predisposing children to insulin resistance early on. That's why you're seeing more and more obese young people, not only when they start eating the way that average American eats, but from the very beginning.
Yeah, it starts at conception. Yeah.
The reverse is also true. You have people that are fat adapted. I mean, breast milk is a beautiful food for a fat adapted person, right? These children.
It's a cholesterol rich melange of all you need.
And, children that are born that have these good habits and predilection for certain gene expression because they're fat adapted early on, and they're stronger in so many ways from an immunologic perspective, for future heart health, liver health, fat metabolism. And I think I know we could reverse the current trend of, everything from the effect of the modern life, not only on our bodies, but it's quite clear that this is also having effect on people's minds, mental health, and in industrialized countries too. It's not just the stress of the environment, like worrying about a job. It's how you're eating, and then how your body is responding hormonally from terms of your fight or flight response and things like that. So this is critically important. It's amazing to me. People would never think to put a child in a car without a car seat, but and that's legislated, and yet at the same time, based on dietary recommendations, we are legislating giving your kids candy for breakfast. So it's like a disconnect in my mind.
Well, not only are we giving candy to kids for breakfast, but it's got the American Heart Association Heart Healthy endorsement on those boxes of cereal.
Yes. So, the vilification of fat, of beef, of a meat-based diet, from not only from the science community, from the marketing community, from the cultural community, is completely off base. And that's my goal. Is I would be irresponsible not to speak to it, especially, you look at the data coming out now relative to the pandemic, and there are articles I see every day. They're researching, why is it that obese people had a higher mortality during the pandemic? Well, and there's lots of funding now for new research, and it's already in the other published literature from decades ago.
Well, it goes back to basic virology. Nobody really argues with, but all these people who are doing all these studies have forgotten. And it's, what I keep saying is viruses replicate glycolytically, and
we love sugar. So people, if you hear one thing from this podcast, viruses love sugar. And so if you're insulin
and so hyperinsulinemia is one of the hallmarks of this particular disease. It's a death. It's basically, if you have hyperinsulinemia, it's pretty much a death sentence.
And also, I was just reading an article the other day, a published paper that comparing viruses, and SARS-CoV-2 actually is a much more vigorous user of sugar and responds is much quicker and replication wise than influenza. So it was a much more, in the presence of sugar, it took off more than the average virus. So being everything that I focus on, and that Peter, that our team, your program at optimizing fat metabolism creates a cellular environment of resiliency. So in a sense, when we said before, can you carry your kids out one under each arm out of a burning building? Are you strong enough? And same thing goes for your cells. How robust are your mitochondria? How robust is your immune system? And we know that people handle the virus differently, and there's no surprise, but the choice may be difficult because people have to change their lifestyle. And so it's good news and bad news. There's no secret to well-being. That's the good news. The bad news is you probably have to give up a lot of things that you've done all your life. Even, people that follow the prescription of the food pyramid, even the Mediterranean diet. I was talking with a couple the other day. The husband had a heart attack, and he's like, we had gone on the Mediterranean diet. We both lost a lot of weight, so I'm really surprised that I'm here. So we had a good discussion about insulin, and they said you should go on TikTok. And I'm like, they were older than me, so I was like, TikTok, because mostly I just talk one-on-one with people about. So it's good to talk in this group that fat adaptation is different than just eating a certain way, and it's not keto, it's not restricting, it's not doing away with all carbs, but you can actually make it doable for people and enjoyable, and the reward of how good you start to feel and how resilient you are in the face of disease, it makes it worthwhile, worth the effort,
Well, and also, here's the thing that I see, you brought up a good point, is like what my epiphany was way back in 2009 when I started working with some early adopters who'd run out of options. So I dug into the basic biology and physiology books, and it really comes down to what you are manifest as an Ironman, completing an Ironman, getting in the shape. It goes right all the way down to that cellular mitochondrial level. And what OFM does, and this is the difference between the diet, the quote unquote fat diets out there, the keto diet, the low carb diet, the Atkins diet. This is not a fat eating diet. This is a fat burning program. So it's about getting the metabolism back to that state. And that part of that is building what I call metabolic capacity in the cells, which means building the number and size of those mitochondrial super complexes that reside within your cells. Because the more mitochondria you have, the more robust that mitochondria has, the greater the capacity to metabolize fat. And that's the energy production pathway is beta oxidation. And out of that, you get ketones. Ketones are a proxy and a byproduct of beta oxidation. And a lot of people don't realize this. And glucose is your fight or flight fuel. And it's got a place, and we don't shy away from it when it's needed for performance. But getting those cells so robust and having that mitochondrial metabolic capacity to burn fat is really where it's at for not just your performance, but your health. Because the reason people don't talk about fat burning is manifold, because researchers like to measure, they have to have metrics and measurement. And that's why the ketogenic diet has been the big fat burning diet, because you can measure ketones in the blood, but you're not measuring all the ketones, because a lot of them are actually spent in the Krebs cycle. But you can't really measure easily the whole process of beta oxidation. And here's where I start losing people, because it goes further than that. Because when you're in beta oxidation, your cholesterol molecules are being metabolized. So cholesterol is a big source of energy, but it's also got all those building blocks for the cells, for your hormones, for your enzymes. And that's all basic stuff Cathy got in med school, but just touched on, right? Because as a clinician, you learn how to treat patients, but you get this basic stuff. But it's that getting the body back to burning fat, which is what we're meant to burn aerobically, is the key. And it's all got to do with those mitochondria and giving them the nourishment, the high oxygen capacity because mitochondria flourish in an oxygen rich environment. And then giving your body from your whole body right down to those cells, that signaling of stress, right? The signaling of physiological stress that tells them, I got to get stronger. And that's what I tell people, right? If you're sedentary signals senescence, which is death. And
the only reason animals rest is for sleep or if they're sick. Otherwise, they're moving. Predators, even and prey, they move. So right. It's critical. Movement is critical. Mm-hmm.
Yeah, and rest is just as critical. Rest is part of that cycle.
Yes. And like you said, stress is really important, you know,
Healthy
whether
stress.
it's because if you don't stress the system, it's not going to get stronger. And but to do it in a way where you minimize any kind of damage, but you increase the benefit of the stress, that's the way to do it. And that's the beauty of OFM too. You can load a mature athlete who's very well fat adapted with a tremendous amount of stress, like Ironman or a 240-mile race, and it makes them stronger, not weaker. So that's really the beauty of the program. And, you know, ketones are just, it's just funny, you know, all these things, whether it's drugs or ketones, you know, they're marketed, you know, people latch onto a concept and then the product is marketed for a profit. You know, there may be some mild, there may be several applications of taking exogenous ketones here and there, but for the average
just like a gel, yeah.
The average person, you know, they don't realize that your body is the best ketone producer in the world. So if you just teach your body to make those, and then you can use them. But by, you know, I'm always surprised when people say, you know, I started taking this ketone supplement, but they don't change anything else that they're doing, and I'm gaining weight. I'm like, it's thermodynamic, it's calories. It's just calories, you know.
Yeah.
So it's, people should start to be suspect of something that takes your normal physiology and then rolls it into a sellable product. Why not just enhance the function of your body, which is already doing, and then you don't even have to, you don't want to do two things. You don't want to do something your body can already do, because it often costs you money, but also it will often shut down your own system because of you're loading things from the outside. So the best thing to do is to make your own engine work properly, and then to supercharge it, which is exactly.
Right. And that's where using gels or exogenous ketones, what I call conditional supplementation or conditional fueling, comes in, because then, you know, in the performance realm, you're maxing out the demand your body can probably produce, and you want to have that little extra that's going to give you that edge to be able to compete, right? So,
and you know, most people don't think of themselves, I mean, we mostly deal with athletes, but everybody's an athlete. People don't normally think of themselves as an athlete, but your event might be your 12-hour workday. I mean, you helped me understand that your event is your 12-hour workday, or running after small children, keeping a house, you know, whatever it is, your day is your event. And so you do that every day. And so that's how you have to start framing your mind when you think of fueling, because you are training for something, and you're training for 5 years from now, right? For your health 5 years from now. And so what you're doing today has a tremendous impact on that, whether or not you'll develop chronic disease. You know, when Albert Schweitzer, famous physician and author and humanitarian, went to Africa, and you look at any indigenous populations, things like cancer, chronic diseases were non-existent. And he wrote about that. That's true, because when you are moving all the time, fueling appropriately, not creating a lot of bad metabolic stress and physical stress, elders in most indigenous populations were extraordinarily healthy and functioning not too far off how they were functioning, you know, decades earlier. So one only has to look at how robust we are as a population compared to people in the 40s and 50s. Really, industrialization and politics has maybe decreased some death from things like starvation and accidents, you know, unintentional
infections.
Yeah, and infection, right, with antibiotics. But beyond that, much of it has caused us to be much less healthy than the populations of the last century and the century before that. And going back, certainly, the further you go back, I would argue that many populations, maybe the majority of them, were much healthier than we are today. But we still have, the good news, we still have the same physiology, we still have the same cells.
Yep.
So it doesn't take a lot to get back. In fact, you can start to feel good in 24 hours, 72 hours. We know we've had experience, Peter, with that with our clients. You just start to feel better immediately.
Yeah.
And
Well, and
your
start
body's saying thank you, you know.
Yeah. And so, you know, especially with the past 2 years, I mean, the past 2 years are really a wake up call, except that you don't hear this from the policymakers that metabolic health, it's very clear in the data. I've been following this, you know, when you look at this and you see it on the front lines as a clinician, you know, people getting in the ICU. I mean, how many people have you seen that you can't find a comorbidity in? Probably none.
No, and we could,
You know,
sometimes the only comorbidity was, even in certain cultures, was excess body fat. And they might not even rule in as obese, but for their frame carrying excess fat, or a behavior in that a diet heavily laden on very high glycemic carbohydrates like corns, beans, that kind of thing. But you could tell, I mean, there were a lot of special things because of the cytokine storm with the pandemic and the IL-6, you know, being made a lot in the adipose tissue and fat tissue. There were even some things that made it that much worse, but it wasn't long before you knew who was going to suffer the worst outcome, you know.
And so this
and
has been,
by then it's too late. You get to the ICU, like this is a bad thing in terms of you are not okay. That's why I said earlier, you know, people say he was fine last week. No, he wasn't fine. He hasn't been fine for 100 pounds, you know. He hasn't been fine for not running around in a playground for the last 55 years, you know. And people really have a warped view of what, and I, as part of the medical community, I mean, we have to own that. Because I hear doctors saying, oh, well, she's only 52, it's only 40. Well, if we're so smart, why are people coming in with chronic disease getting younger and younger?
you know, I want to frame this from a different perspective. I don't think that probably the vast majority of the frontline people, the clinicians, the doctors, the nurses, the techs that are helping, I think there's a genuine desire to help people.
Oh, yeah.
But I think that with our lives being so programmed and everybo's so busy, and hospitals being, you know, entities that need to generate revenue, I don't think people have the time to stop and really think and consider some of these things the way, you know, we have in our conversations starting back in 2013 when we met at that metabolic conference. That, you know, that you noodle and you have these aha moments because, you know, I just think that, you know, is it wrong? Yes. But is it done with, you know, bad intentions? I think we go back to that saying, the road to hell is paved with good intentions. And, you know, somebody's got to say, you know, stop, let's kind of take a reset here and try to look at this from a different angle, because, you know, I know what you're saying, because, you know, where I live here in California in the Central Valley, you know, the emergency rooms are just overcrowded with people who are coming in. They're flooded, and everybody's going through the same monkey motion. And, you know, are they focused on trying to save lives in the heck? Yes, they are, just like you are. But nobody's standing back. You know, when I go in there, when I've made those trips to the ER with somebody, I'm looking at these people and it's like, oh man, this is not a good situation. I wouldn't want to try to keep some of these people alive. I mean, I wouldn't know how, but, you know, looking at them, and then you look at their, you know, family members or friends are bringing them in there. They're not the paragon of health either. And once again, we're not bagging on anybody or even the doctors are the paragon of health. It's just, you know, we've got to make some noise about this and get back to the, you know, what's the core thing. And it's this whole thing of your metabolic physiological function that's supposed to be back. And and also not only is it been dumbed down, but all your studies now are based on a population that's not optimally healthy. They're not doing Ironmans, and they're not fat adapted in doing Ironmans, right? I don't want to say that the guy who does Ironman is taking in 400 calories an hour on the bike is healthy, right? Because to avoid a bonk. But somebody like you know, we don't study healthy. You said something earlier about this, and it got me thinking about how all the news people hear about is about disease in health, right? Avoiding this, avoiding that. And it's like, why aren't we looking more at the inspirational type of things and what's working? And that's what I'm trying to do with us, like with you, with Beth, who just completed an Ironman, pushing and pulling her adult disabled daughter, right? She's, I remember one day she said, "I'm a freak, I'm a weirdo." I said, "No, Beth, you're what normal should be," just like you said earlier, right?
Yeah.
And this is a woman who's just like you, a woman in her mid-50s. And sure, a lot of what's driving her to complete an Ironman with her daughter is love, a mother's love. And that's a pretty fierce thing. But she's also been able to consistently do that because she's a fat burning machine. And so
Well,
we
then, yeah,
don't
the main
we don't
tenet.
study this. We don't study this enough. And this is an initiative I'm trying to do. And we were able to get it started a bit with Steve Finney and Jeff Bollock with the FASTER study, but that focused on a ketogenic diet and not that bigger paradigm. And so I think one of the big take home things for the audience to noodle on is, how come we're not studying people like you, Cathy, doing, and when we did this data collection this last February with people, the gal who took, she does health, she does VO2 testing. She's never seen data like this, right? Yes. There's no data out there except the data we have that shows people like Jeff and Peter capable of burning over 2 grams a minute of fat, for several minutes. We did an RMR on one guy who was the least fit there because he got up at 3 a.m. and drove from LA to Phoenix, but his resting RMR was 100% fat burn. And the woman was like, 70% fat burn in RMR is considered really healthy. And so,
in scientific inquiry, it's important to challenge existing paradigms. I always say at some point there was someone, when I started my residency, we were doing mastectomies for breast cancer because the idea was that cancer was a local problem and then it spread. And it wasn't until somebody challenged that hypothesis and said, maybe cancer is already all throughout the body, but it's just showing up locally. How would that change? And then they did a study and they found that, local excision with radiation in a lot of cases had equal to or better outcome than mastectomy, because of the less complications and morbidity. So it's really important. And so that's kind of what launched my inquiry. I was in the ICU one day in 2014, and it occurred to me, who doesn't come into the hospital? Why don't we study those people? Because these people are getting younger and younger. And how do we stay well? How do we not get sick? And so, I think you raised a good point too. There are a lot of athletes out there that are not healthy. There are a lot of top professional athletes that I wouldn't call healthy. I can tell you that bonking is not normal. Hitting the wall, is not normal. Diarrhea, vomiting during a race, no matter how long it is not normal. Okay, so carrying, just because you can finish an Ironman, if you're 100 pounds overweight, and I saw that because these people probably were like 300 pounds overweight when they were first starting to train. But you think of a cheetah, a leaf but healthy animal is the norm. So I think it's important across the population to say that, that's what kind of differentiates OFM. It's not just about being lean. It's not just about trying to finish a race, but it's about how do you function at a very high level of your physiology and be better for it and not suffer all these things, again, that we've come to accept. People, accept hitting the wall and diarrhea and GI issues as normal. What's normal when you get up to that level of fitness? No, it's not. The human body runs, when it runs properly, it runs like a Lamborghini or a Maserati. And that analogy breaks down because those cars, they often have problems and break down, but it is a well-oiled machine that it's very, very hard to break it down. And if you're having a malfunction in any way, whether how you think or how you feel or how you perform, then something is not right, because that is not acceptable normal physiology. And that's, I think, the important message to get out. Like, people seem to have this idea that, well, my body, eventually something's gonna go wrong. Guess what? No. No, again, you look at those indigenous populations from the past, and they had the elders in their groups had an extraordinarily high level of function, and were devoid of chronic disease. I always used to look at, if you look at the pictures of cowboys and Native Americans from the past, when Americans were first pushing west, and you'll notice, like, I always thought as a kid, I wonder why they have dentures. Like the Native Americans had like false teeth, I thought. No, they just had really healthy teeth. Simple things like dental caries, wounds, things like that, they healed because their physiology functioned normally. So that's really what we have to get back to. And, we can sit here and talk about biochemistry and the concentration and performance of your mitochondria and the density of your microvasculature and your muscles and how they work. But at the end of the day, it's all these little things are very simple examples, like good teeth, fast healing bodies, ability to move, a low body fat look. They're very simple bits of evidence that we're now on the wrong track.
And the beauty of this, for the audience, like Cathy and I, in our private conversations, we'll go down these rabbit holes, or I'll go down rabbit holes, and I lose people all the time. And this is one of the things to know, is like, that's what we do because we're curious about this and we have the educational background to go down those rabbit holes and understand what's going on. But if you don't have a university level biology, physiology, organic chemistry, biochem background, which I got slaughtered in with all the pre-med and pre-vet students at Davis, you just get lost. And yes, when you break down all these processes on a modern, didactic, conscious level, it's incredibly complex and interrelated. It's impossible to try and track it all. But the beauty of what we're doing at OFM is we take that and bring it to a level that's in harmony with our natural evolutionary path. So the actual execution of it, once you get the basic concepts, is incredibly easy.
Straightforward. For wellness, there's no secret. You just have to go back to your natural physiology, which is fat adaptation.
Yeah.
You'll think clearly, you'll feel happy, you will handle stress better, your immune system will be stronger, you will avoid developing many, many chronic diseases. You will just feel better overall. You have energy beyond belief. And that's our normal state of being. And no matter what your life is like stress-wise, you'll be handling it better. And so we want to create an upward spiral where everything gets better and get out of this downward spiral.
Well, and also to a point about your thing about meditation, see, a lot of things, like, we try to get you away from this didactic counting calories, calculating macros, very uber metric driven training programs with high structure, and get you into that zone, because what Kathy was mentioning about, excuse me, I had a brain fart here, about meditation. Okay, meditation is simply getting in the zone. And when you're trying to keep track of conscious thought, you can't. And so physiologically getting into that zone, whether you're meditating or you're just deeply into a project or a piece of music or a book, that sets up some really amazing physiology, whereas trying to keep track of all this stuff, whether it's your calories or macros, or whether you put your left bike shoe on first or your right bike shoe on first at T1. And really, there's some people who try to go that far. That's really stressful. That sets up cortisol. It's just so damaging your body. And so, the whole point of how we do things is to not have all these metrics. Yes, we use a little structure and some guidance, but is to release you from all that hold. There's no apps. We don't want you to be using an app because, all you have to do is look around and sometimes even look at the mirror at people that are just scrolling through their phones and devices and constantly getting distracted. And that's, like I say, that's pinging some very primitive physiological fight or flight physiology.
Yes.
So, yeah.
It's really all comes down to, it starts with what you put in your mouth and how you fuel your body. And that ties into, helping you think better, and then taking a little bit of time. Epigenetics tells us how important thought, so it's not just the external environment, but the internal environment is on your physical processes. And then, so fueling, thinking, and moving, how you do those three things will predict your life. Yep. And that's what OFM is all about. Because through your diet, you handle the stressors better, you make better decisions, you move more, you feel better, you want to eat the way because you're feeling better, you're more motivated to eat, you can be more disciplined, you're more relaxed. It all creates this beautiful synergistic effect. And then you feel good. That's what everybody wants to do. They just want to feel good. And that's what OFM, and I'd argue it's, again, that's the good news and the bad news. The good news is you don't really need anything outside of yourself to get healthy. And the bad news is you're your own hero or not,
That's right. That's exactly right. And this is why you don't see, everything's programmed, including a lot of the health gurus and influencers, because they're citing the latest literature and this and that. And then we've got this whole pandemic stuff on the health. And nobody's talking, like I said, nobody's talking about metabolic health yet. It's very clear from the data that that's a key marker for what your outcome is. So you don't see these studies because guess what, folks? There's no money in it for that outside entity. The money stays with you, because getting healthy, truly healthy, puts you at arm's length from the treatment pathway that we've sort of evolved to in this modern human lifestyle, because it generates revenue and everything's predicated on that. And so you have to realize that the wealth, instead of transferring that wealth, the wealth and your health in a progression as you age chronologically, and everybody thinks this is normal, just like poor health is normal, you're going to be taking back that wealth. And this is the problem, is like Kathy says, you have this genetic programming that got you here. Your genes, this thing where people pull the genetics card up first and say, oh, I've got bad genes, I can't do this. No. Unless you were born with a genetic condition, your genes are not your destiny. You as an individual have to figure out how to make those epigenetic markers manifest themselves in positive ways. But the point is, your genes got you here because they're robust genes.
That's right.
Right? I mean,
right. We all have the same, they have mapped the human genome, which is which genes do you express. And the data is clear that the environment, again, is is tremendously important in what is expressed. So the reason most people have the same genetic propensity for heart disease is likely it's because they adopt the same patterns that their parents had, that their families had, the same eating and behavior, stress management patterns. And that tends to exert then a similar influence on their genetic expression.
Yeah, and that's in the modern age, whereas when you look at that same gene pool, it probably came from a gene pool that was more of a hunter-gatherer gene pool. And you know, because I think about these things, and I look at it as like, okay, we have what I call sentinel populations that are markers for these things. So you have, you know, African Americans, American Indians, Eskimos and Inuits, Polynesian Islanders. I call those sentinel population groups, and even Eastern Europe, because when you look at how agriculture began and started in the Fertile Crescent and migrated out, literally, that was just selective genetic culling for carbohydrate tolerance, right?
Yes.
And so those people who adopted agriculture, those genes that didn't have much tolerance for carbohydrates got wiped out pretty quickly. And then when you start to think about this, even Middle Easterners who remained hunter-gatherers, they're very susceptible to getting a heart attack at 40. You have Eastern Europe. A lot of people don't realize that Europe, you know, until World War I was largely relegated to a lot of fiefdoms east of Germany, right? Because Germany was even a lot of fiefdoms. So people lived in these isolated pockets, and a lot of them lived the way their ancestors lived for tens of thousands of years without a whole lot of agriculture and trade in what Weston Price called foods of modern commerce. And same thing with like African Americans. How many generations of carbohydrate tolerance culling did they have, you know, since slavery, right? American Indians, since they were relegated to the reservation. So these groups are Polynesian Islanders, not till the 30s and 40s, because these populations didn't have the tens of thousands, you know, 10,000 years of genetic culling. And I don't know if that gets across to people, but that's how genetics are expressed, you know. And so, you know, you might have some Eastern European background, you might be white, but Eastern European background in you that, you know, you might have had a father that came from one of these remote areas that, you know, in his time, in his space, he would live a good long life. But in the modern world, on modern foods, it's a heart attack at 40, right? So I hope I'm not losing people there, but that's kind of thing.
No, we're not, well, you know, we like to think we're very, very evolved, but in the 40 years since World War II, or maybe a little longer.
80 now.
Yeah.
Yeah.
You know,
60.
The technology has advanced a lot more than physiology, and we're still the same human we were then, but like you said, our lifestyle is completely different, and unfortunately in a lot of ways for the worse. So getting back to those conditions that helped our, you know, helped our ancestors survive is the way to health going forward.
And yeah, we can have the best. We can have the best of both worlds, because neither one of us are advocating going back and sleeping on the ground. I mean, we have the best of both worlds.
Yeah, and I was going to say, so we need to use technology with like things like certain very critical supplements, or like Vespa, to use technology to further enhance our physiology, not to hurt it.
Yeah, and that's kind of my philosophy with the supplement end of it, is like a lot of the supplements, you know, probably 80% of the supplements that we recommend to on an individual basis to the individual, you know, they're natural, they're very natural. Like Vespa is a natural product, it's actually classified as a food, but like, you know, vitamin D and magnesium, like I don't want to supplement with vitamin D and magnesium, but very few people expose their body to enough sunlight to do it endogenously, right? And very few people are eating enough seafood or eating plants and animals that are grown on wild native grasses that haven't been cultivated. So there's there's certain things that we have to account for our modern life and adapt, but try to have that philosophy of how do we work with nature rather than do a shortcut. Because sort of what I'm finding, Kathy, is like we humans think we're so clever, and we keep forgetting that as much as we do know, and I'm not saying we don't know a lot, like I said, modern medicine is amazing and it's a miracle, but we keep forgetting how little we really know. And every time we come up with a shortcut, there's unintended consequences, and we forget about that.
Yeah, I don't like everybody's interested in hacking the system, a shortcut, and it's insulting at best and disastrous at worst to try to shortcut this perfect system of our physiology.
Right.
You just have to tap into it, not hack it, because I think biohacking is a connotation in all the worst ways, in all the worst.
If you're a biologist and you understand biology, it's just like, it just doesn't make sense, right? It's an anathema, but
And there,
I get
like you
it.
said, there are some interventions out there. 5% of the population has a true genetic abnormality, but the 95% just have to stop hurting themselves, and that's what OFM does. It brings the body back into balance.
Yep.
Then it's fueled properly. It's moved properly, and then you could start talking about how do we enhance that to make you feel even better.
Yep.
So I think there's no secret to well-being. You got to get yourself fat adapted. There's a reason why the Department of Defense, for their elite corps, know all about this stuff. Having to fuel in austere environments and keep your mental clarity while you're under duress, not only from a food perspective, but an environmental perspective, a sleep deprivation perspective. Metabolic resilience, your body is a fortress when it's properly taken care of. And all of these things, that we're afraid of, especially over the past couple of years, that we've been told we should be afraid of. It's not that you throw caution to the wind, but you can have the security of knowing. If you had a fortified castle and you knew an army was coming, well, that's better than being in a grass hut and feeling like an army's coming. So the offer of OFM is a strong, robust physiology. It's natural. It comes naturally. It's easy to execute. It's extraordinarily cost effective. And so, that's my big message to everybody. There's no secret to well-being, whether you're talking physical or mental well-being. And any derangements you might have in the system, the current lifestyle in America in general is making all of those things worse. They make you feel better. A lot of things make you feel better in the moment, but it's really a ruse, because ultimately you're doing a lot more damage. It's kind of like I said, like letting a kid ride in the back of a pickup truck. It feels kind of good in the moment, but when an accident happens, instead of being safe in a car seat, surrounded by a lot of metal, you get thrown and you basically don't have a chance. And that's a situation that's being created by the average lifestyle. It's a situation when a threat comes, you really don't even have a chance. It's just a matter of how fast are you going to succumb? How fast are you going to die? Slow, like a line from a movie. Quick, like the tongue of a snake, or slow like molasses. And that's what I see every day, and it's unnecessary, because there's a lot that people can do to bring themselves back into a healthy way of being.
Yeah. And the thing is people need to realize the human body is hugely resilient. And we're not talking about you, Kathy. We're talking about the persons you see in the ICU.
Yes.
That people can come into the ICU in the condition they are and still be alive, and the fact that you can pull them from the jaws of death. It's like we have such a tolerance and resilience that we have this latitude to have allowed ourselves to sink into this whole, rather than recognize that, we really need to value the gift we have and try to build and enhance that. And I think, to close this off, I think one of the things is the longevity, because when you're burning fat, you're reducing the oxidative stress, you're reducing the lactate load, you're reducing the glycation, which is called AGEs, aging. And that acronym is no accident, because glycation is one of those things that accelerates aging on a cellular level and on a body level. And so, if you're watching this, just take one look at Cathy, and she's not only looking great as a woman of a certain age, and
56. This is 56.
and proud of being 56. Okay. She looks great, but she's also functioning at a high level as an intensivist and an Ironman. And so, and then, you look at some of the other athletes we work with, like Jeff Browning or Peter Mortimer or Beth James or Diane Credenda. And, that's the thing. Let's look at the people who are doing this at a age that's far advanced from what people think is normal. I mean, it's normal to see our performance drop off as we age, but yet, you see somebody like Jeff Browning or the football player Rinaldi. Now, I don't know what he's doing, but he's probably got the best people around him, and he gets it in terms of taking care of himself. But Jeff, Jeff at 51 is still one of the top mountain ultra specialists. And, I was talking with him, and when I looked at his ultra sign up results, he's doing more big events than anybody else in the sport. So he might be in the top 5 or 10 elite ultra runners in the country or in the world, might be in that top 10 of elite at his age, right? He's not in his 20s or 30s, he's 51. But yet, if you took those top 10, nobody's doing the amount of competitions and big things. And to a point, he's on that cycle of after every event, from 4 to 7, 8 weeks later, he's getting the bounce, that rejuvenation from the adaptive stress to go there. And so, but, you don't have to do an ultra, you don't have to run 240 miles, you don't have to do an Ironman, you just got to get started. And it starts with that metabolic health. So Cathy, anything you'd like to close out with besides looking fantastic and feeling fantastic?
No, that's that the secret is there's no secret. You just have
enjoying life, right?
You just have to get back to your normal physiology, and that's what OFM is there to do. And again, from my position on the team is to pledge that I never ever recommend anything that's not based in science, that I'm not doing myself, and that isn't for the benefit of health and longevity. So thank you, Peter, for what you do. Thanks for having me on. Thanks for listening, everybody.
Yeah. No, and we'll be doing that. We'll be doing more of these. So can't wait to do that. Well, have a great rest of your day, Cathy.
You too. Hopefully people will send us some questions and can help, what they want to hear about specifically going forward. And
I think what we'll do is we'll probably have some stuff for the paid content subscribers where we can do some sessions and talk about both from my perspective with OFM and your perspective with OFM as a clinician and the medical implications. So it's going to be good. Can't wait.
Thanks, Peter.
All right.